To the foot and ankle orthopedic surgeon. Today we're going to take a look at how you might identify if you've had a Lisfranc injury. It's a very serious injury, one that we've talked about a lot before. It is missed in 20 to 40% of cases, and hence to know a few signs to tell you that you've had the injury is important. Now, this is a drawing of the foot. The injury with a Lisfranc injury is to the Lisfranc ligament, which is a rope essentially in the middle of your foot that runs from a bone in line with the big toe, known as the medial cuneiform, and we're going to mark that out for you now. It's a sort of square-shaped type of bone. The ligament then runs to what's called the second metatarsal, which is a bone in the middle of your foot, which runs in line with the second toe. If you do an injury to this area, you can get flattening of your arch over time, and it can cause instability to the middle of the foot, so it's quite serious. Now, the mechanism by how you would do this injury is typically your foot's got to be in a position known as plantar flexion, which is where the heel is pointing upwards. The ball of your foot and your toes are on the ground, and what will happen is you'll suffer what's called an axial force, which is a downward force through your leg. Now, often in rugby league or rugby union or NFL, this usually happens in a tackle, but for the rest of us mere mortals, it often happens when we're falling down some stairs or missing a pothole or stepping off a gutter. That'll be the typical mechanism for the rest of us. And as I said before, the injury will be to the Lisfranc ligament. We're just going to draw it here in two parts. It can occur just as a complete ruptured ligament itself, or often it'll occur with a fracture, which can be identified either on an X-ray or CT scan. Now, what happens then is that the bone, which is in line with the second toe, known as the second metatarsal marked in red there, subtly moves away from the big toe and causes issues with your arch. One of the main signs of this injury is something known as plantar ecchymosis, which is bruising on the underside of the foot. That sign is what's known as pathonomic. So if you've got this sign following an injury, it's very likely you've had a Lisfranc injury. One of the other signs that can indicate you've had a Lisfranc injury is pain in the middle of the foot. Very, very likely if you've had an injury that you've got a Lisfranc injury if the pain is in the middle of the foot, particularly if it's where the yellow arrow is there in line with your second toe in the middle of the foot. That is very likely then you've had a Lisfranc injury. One of the other signs, maybe you have difficulty weight bearing on the foot following an injury. Lisfranc can be difficult to put weight through, especially in the initial stages. And if that's the case, you really should see your doctor, potentially for an X-ray or further scans. Now, if you present to your doctor, it's very likely they're going to do some X-rays. These X-rays are done usually weight bearing. The X-ray on the right with the green circle is normal. The X-ray on the left is abnormal where the red circle is, and the difference is there's a bigger gap between the bones known as the first and second metatarsals there, and that sign will be indicative of a Lisfranc injury. Sometimes the X-rays are normal, and if that's the case and you've got pain in the middle of the foot, you really should have a CT because you may have one of these chip fractures here which you're going to mark out with the red circle. So it shouldn't, if you've got a normal X-ray, it doesn't rule out the injury. You may need a CT scan, and that's something that you can talk about with your doctor. In saying that, if there's no fracture, you may still have the injury. If you've still got pain after weeks, an MRI scan may be useful. This scan shows the red line there where the ligament is ruptured. When we remove the red line, we can see there's no black line there, which on the MRI would indicate the ligament unfortunately is ruptured. And so you may need an MRI if you've got ongoing pain despite a normal X-ray and CT. And that's important to know. Now, I hope you've enjoyed our talk. We just included a few signs there to show you what can indicate a Lisfranc injury. If you've liked our video today, please take a look at some of our other videos or subscribe to the Foot and Ankle Orthopedic